Okay, what's the defect in tetralogy? It was first described in 1888, and there were a number of, there were actually 4 structural lesions that were recognized. One was an overriding aorta. And I think, was it Stephanie? Somebody asked me about what an overriding aorta was that they never really understood. If you look at this diagram, the blue is the deoxygenated blood, the red is the oxygenated blood, obviously. See the pulmonary artery, but you can see the aorta there overrides a ventricular septal defect, right? They're not supposed to be mixing of blood there. So you can see into the aorta is going this purple blood, which means it's not fully oxygenated because it mixes. So the aorta is overriding the right ventricular outflow tract, and there's a hole, a defect, a septal defect that's not supposed to be there. Okay, so therefore the blood going to the circulation isn't fully oxygenated. So I think the 4 structural anomalies that were noted were an overriding aorta, hypertrophy of the right ventricle. What was the other 4? I can't remember what the 4 are exactly, but what, do you know?
Yeah, pulmonary stenosis.
Pulmonary stenosis, okay. I don't know that you can really see that on this diagram. Right. Okay, so what children who have tetralogy do is have tet spells. And that's what we were calling them. And you can see when they valsalva or cry, get upset, they can exhibit a lot of cyanosis, which can resolve spontaneously. The second T is a truncus. And what you have here, you can see there, is you have one big vessel coming out of a common ventricle. And so there's a large ventricular septal defect. You have this big vessel giving rise to the pulmonary vasculature, right? And so there's obviously mixing, and that's why the patient is cyanotic. Normal on the right, on the left, and the truncus on the right. So it's just one big trunk coming out of a sort of what looks like a common ventricle. Tricuspid atresia, this is a schematic. I thought it would be easier. The tricuspid valve is between the right atrium, right ventricle, okay? And you can see on the right side there, the right atrium, really there's no communication, so what happens is there may be a patent foramen ovale. All right, that's the little hole between the atrium, okay? So the blood comes into the right atrium because there's tricuspid atresia, can't get into the right ventricle, so the right ventricle shrinks down. You can see it's very, very tiny there. And through a patent foramen ovale or an atrial septal defect, the blood mixes with what's in the left atrium, which is oxygenated. So now the blood that goes to the periphery is not fully oxygenated. So you have cyanosis. And then finally, anomalous pulmonary venous return. The problem here is that all 4 pulmonary veins connect to the superior vena cava. So superior vena cava has deoxygenated blood, right? And the pulmonary veins have oxygenated blood. So now you're going to mix that, and we'll end up with deoxygenated blood going out through the aorta. And then finally, transposition of the great arteries. I always found this the most fascinating, is actually when you have the aorta coming out of the right ventricle and the pulmonary arteries are transposed. Okay. So you have 2 serial circulations going. But the blood comes into the right ventricle, and goes out the aorta before getting oxygenated. And so you have 2 parallel circulations. The treatment for this is actually described as a vessel switch, where they switch them around and put them where they're supposed to be. Yeah. And you can think that it's in a patient that's this big. You have a new respect for cardiac surgeons. So. Okay, so remember there's 5 T's plus tons of other stuff for cyanotic congenital heart disease. Right? Talk about congenital disorders of the nervous system. One of the big general categories is neural tube defects, which give rise to something called anencephaly or spina bifida of varying degree. And I'll go through what the neural tube is in a minute. Anencephaly is absence of all or major parts of the brain. Spina bifida, in severe form, has an overall mortality of up to 15%, most deaths occurring before 4 years of age. The extent of paralysis or mental retardation depends on the extent of the defect, and a lot of children with spina bifida have chronic care needs. So this is a group of patients that you may see if you do pediatric palliative care. And both anencephaly and spina bifida combined can occur in up to 1 in 1,000 live births. So it's a little embryology. If you remember, this is the ectoderm. It's a layer of ectoderm. Right? And what happens is this little area called the neural plate invaginates. Okay? And so the little ridges are called the neural folds, and they gradually come together. And the area on top there's the neural crest, and make a spinal cord. It's a little tube. Okay? And so this is looking at it from above. Okay, so you have this area of ectoderm that invaginates and makes a tube. So in anencephaly, the top part of the tube is not developed. Okay, and in spina bifida, you just have incomplete closure and an evagination. You can see there of the spinal cord out, and generally the baby presents with an open defect in the back, which has spinal cord material or spinal fluid, depending on how much evaginates out. There are genetic factors with neural tube defects. There's one big category is folic acid deficiency and folate antagonists. A couple of years ago, it was strongly recommended that all pregnant women take folic acid immediately because the critical development period of this is less than 24 weeks, and even earlier on. So as soon as you find out you're pregnant, you must go on folate at this time. And then there's finally metabolic disorders that are associated with it. So what are the important drugs that inhibit folic acid? Because if you have a history of seizures in a mother, this may be part of the explanation. Okay, so carbamazepine, phenobarbital, dilantin, primidone are 4 anticonvulsants that inhibit folic acid. So that woman who has a seizure disorder who gets pregnant is at risk for her child to have a neural tube defect. Sulfasalazine is an anti-inflammatory, triamterene antibiotic, and trimethoprim, which is part of Cetro, very, very commonly used antibiotic. So one must be aware of this. Certainly more important for the obstetricians, but so I think anyone who has early good obstetrical care probably should not have a neural tube defect due to folic acid deficiency.